Hello everyone, and welcome to another insightful video from McMaster's Demystifying Medicine team. On today's episode, we'll be talking about how virtual reality can be used to treat substance use disorders, SUDs. We'll briefly explain what SUDs are, the role of VR in the treatment of SUDs, and some studies that provide evidence for the efficacy of this approach. What is substance use disorder? A substance use disorder, SUD, more commonly known as addiction, is a mental disorder that affects a person's brain and behavior, and it often involves a person's inability to control their use of substances such as drugs, alcohol, or medication. These disorders are characterized by habitual and pathological patterns of drug-seeking and drug-consuming behaviors. Addiction is known to affect the neural networks involved in the reward circuit, inhibitory control, stress, emotional processing, learning, and memory. There are multiple proposed pathways that lead to addiction, and they involve the release of specific neurotransmitters which alter the brain sensitivity to reward and stress cues and environmental influences. Additionally, factors like cognitive, behavioral, motivational, and emotional constructs such as depression, risk-taking, and/or unresolved trauma also play a part in the pathway to addiction. The primary regions of the brain that are involved in the development and persistence of addiction are 1. The basal ganglia, which controls the rewarding effects associated with substance use. 2. The extended amygdala, which is involved in stress and the negative feelings typically accompanied by substance withdrawal. And 3. The prefrontal cortex, which is involved in executive functions, including exerting control over substance use. How do people get addicted in the first place? Addictive substances produce feelings of pleasure, and the rewarding effects positively reinforce their use and increase the likelihood of repeated use. Continued misuse of alcohol and any such stimulants can cause structural and functional changes in the brain to occur, which can lead to tolerance. These changes can be responsible for transitioning an individual from occasional use to chronic misuse of substances, and these can persist long after substance use stops. These are associated with high incidence of relapse with substance use disorders. A common therapeutic approach to treat addiction is cue exposure therapy, where the client is exposed to stimuli that induce cravings for substances, while the therapist uses other techniques to reduce or eliminate the craving. Repeated exposure to the substance leads to a reduction in craving and is effective in preventing relapse. The biggest limitation of exposure therapy is that cravings are often context dependent. This is where virtual reality comes into play. Instead of just looking at a 2D image or video, you can actually enter and experience the potentially triggering environment. Virtual reality, or VR, is the use of computer technology to create a simulated environment that can be explored in 360 degrees. Unlike traditional interfaces, VR places the user inside the virtual environment and gives them an immersive experience. Virtual reality cue exposure therapy, VR-CET, is much better compared to traditional cue exposure therapy because 1. It's more practical. 2. Treatment can easily be compared between providers due to the structured and standardized stimulation protocols. And 3. You can have the benefits of a controlled simulation with the advantages of a realistic environment. Now, let's look at some studies that look at the efficacy of VR intervention on addiction. Study 1. This study from 2012 assessed the feasibility of using a VR-based cue reactivity assessment approach during a nicotine addiction treatment. 46 treatment-seeking, nicotine-dependent adult smokers were assessed for cue reactivity before treatment, as well as at 4 weeks and 10 weeks of treatment. Measures of cue reactivity included subjective craving and attention to cues after exposure to 2 neutral and 2 smoking cue environments. The neutral environment consisted of a digital art gallery presented with nature videos and fresh flower scents in which participants could look around without the presence of smoking cues. The smoking paraphernalia environment consisted of a home bar area and a living room scenario with various smoking cues but contained no social interactions or people. The party environment consisted of a house party where participants were exposed to people drinking, eating, and talking, with alcoholic drinks and smoking stimuli like cigarettes on tables and cigarette offers from other guests. During the Q assessments, cigarette smoke, raw tobacco, and pizza scents were presented in the smoking party and paraphernalia environments. The intervention was very effective because, as seen in the graph, the craving rating was significantly reduced after week 10 of therapy. The last one we'll be covering was a study published in 2022 where 21 patients in early SUD recovery interacted with future versions of themselves from two different behavioral trajectories, an SUD future self and a recovery future self. The present self avatar was designed to look identical to the participant's present appearance, whereas the future self avatars were age progressed 15 years. The diminished physical and psychological states of the SUD future self were shown with additional aging and indicators of poor self-care, darkening around eyes, color desaturation in the skin, and unkept clothes. The SUD future self was unsmiling, downward gazing, slumped in posture, and more fidgety. In contrast, the recovery future self smiled slightly while speaking, maintained eye contact and an upright posture, and appeared calm and poised. By experiencing vivid and realistic personal futures, participants showed greater future self-continuity, which persists 30 days later, reduced cravings, and refrained from drug use at high rates. The intervention was well tolerated and demonstrated the feasibility of implementing a VR intervention in a clinical setting. Patients' testimonies included, "If I stay on the path, I can see the life I envisioned for myself. And it made me imagine what it would be like in the next 15 years to get to that point. All the wasted money, opportunities, and relationships. It made me feel sad. Hearing myself saying getting sober was the best decision I ever made stuck with me." The feedback highlighted that even though the experience from VR was not real, the cognitive and emotional states it elicits are. To wrap up, currently, several other ongoing studies are looking into the use of VR for substance use disorders as well as other mental health issues. Based on the evidence from past studies, it is evident that VR has a huge potential to be used as a therapeutic approach for addiction. Although we featured only 2 papers, we encourage you to keep looking into more since new discoveries are being made every day in this field.